Are you in the fifth month of your pregnancy and do you have bleeding? Then watch this video. Now, most important cause for bleeding in pregnancy is the placenta. So if the placenta is low lying, then it can cause bleeding, and this is called placenta previa. Generally, the placenta moves up as the uterus grows, and therefore only 1% of patients continue to have placenta previa. 99% of them it moves up. Sometimes there is a separation of the placenta from the wall of the uterus, and this happens whenever there is excessive strain, and sometimes it just happens because they already have an issue which in the blood which causes this separation. The antibodies reject it, and therefore they have this separation. Sometimes it is not the placenta, but it is because of small polyps in the cervix, that is the mouth of the uterus, and sometimes there's an erosion. It's a sort of ulcer in the mouth of the uterus, and this also, particularly after intercourse, can cause bleeding. And it's very important to understand this because sometimes the bleeding is very heavy, and placenta previa can cause torrential bleeding. So watch out, and if there is bleeding, do an ultrasound, check the position of the placenta, check whether there's a polyp, check whether there's any erosion, and correct it immediately. Because if you continue to bleed, sometimes it goes on over months, and that can cause a decrease in hemoglobin, and the blood flow to the baby also may go down. So it's important to give this a lot of importance.